is recognized.
Well, sir, you asked for a physician to stand. I am a physician. I'm an emergency medicine physician who served during the entire COVID pandemic. From before the pandemic began, I'm sure I was exposed to it over 1,000 times with thousands of patients that I treated for COVID, some of which I intubated. We had healthcare workers who had had decades of experience, exposed over and over again before there even was a vaccination. People went home sick. They had fevers. It may surprise you that I was never tested for COVID. Not in the entire career that I've had as an emergency physician have I ever been tested for COVID. And yet I came to work time and time again, putting my life on the line. I lost friends. I watched people put their lives on the line and come to work when everybody else got to call in or stay home based on congressional mandates or congressional exceptions, because we were essential, because we understand our profession, we understand how important it is to public service, to save the lives, to learn, and to continue to grow, to have the debate over what would and would not work for patients. And we evolved. It wasn't just one size fits all for medicine. People are not treated the same because people are different. Different exposures require different treatments. Once you've had the disease, you develop an immunity. If you have immunity and you're exposed to a vaccination within a certain time, you can have a hyperimmune response that can be harmful. This is not taken into account by congressional people who do not understand medicine, who have not been to medical school, who have not had a residency, who have not had decades of experience, either as a doctor, a nurse, a mid-level, or some other healthcare professional who understand healthcare far more than anybody who sits in these seats, who have never treated one patient or read one book or had one test concerning the outcome of a patient. They've never held the hand of a patient who is dying. And so I would challenge you, sir, to consider a healthcare professional when they get to determine their own fate as they continue to put their lives on the line to serve the very people that we are supposed to be serving here in Congress. And with that, I yield.